Have you ever felt your heart race out of nowhere, as if you were running a marathon, even though you were standing still? Or perhaps you've noticed irregular beats, as if your heart was losing its rhythm. This could be more than just anxiety. What if I told you that your thyroid could be behind it? Today, we're going to talk about a topic that few associate with thyroid health: arrhythmia and tachycardia. Did you know that hyperthyroidism can put a strain on your heart? And how can you find out if this is the case? Stay with me to understand how your thyroid function can be directly linked to your heart rhythm, and, more importantly, what you can do to treat these symptoms. Hyperthyroidism can have a direct impact on the heart, leading to problems such as arrhythmia and tachycardia. This is because thyroid hormones play an essential role in controlling cardiovascular function. When there is an excess of thyroid hormones in the body, the circulatory system is put into a state of continuous alert, which can cause serious heart problems. Tachycardia is characterized by an abnormal acceleration of the heartbeat, causing the heart to beat faster than normal, even when the person is at rest. This increase in heart rate can be uncomfortable and, in some cases, dangerous, as it can overload the heart. Arrhythmia, on the other hand, refers to irregular beats, in which the heart may appear to skip or lose its rhythm. But why does hyperthyroidism cause these problems? When thyroid hormones are high, they affect the sympathetic system, the body's fight or flight mode, stimulating the heart to beat faster. In addition, these hormones can alter the electrical conduction of the heart, leading to arrhythmia. This mismatch can result in frequent palpitations, a feeling of discomfort in the chest, and even dizziness. People with hyperthyroidism have an increased risk of developing atrial fibrillation, a serious type of arrhythmia, which can increase the risk of stroke. It is therefore crucial to monitor heart health in patients with an overactive thyroid and seek appropriate medical treatment. The symptoms of arrhythmia and tachycardia related to hyperthyroidism can be quite uncomfortable and often frightening. An overactive thyroid releases excess hormones that directly affect the heart, speeding up the heartbeat and causing irregular beats. These symptoms are often one of the first signs that something isn't right with the thyroid. Palpitations are one of the most common complaints. People report feeling their heart pounding or skipping beats, even without physical exertion. This can occur at any time, during normal activities, or even at rest, and can be accompanied by a feeling of discomfort or pressure in the chest. Rapid heartbeat is another typical symptom. The heart can race, reaching over 100 beats per minute, even when the person is at rest. This constant acceleration can make the body feel permanently on alert, resulting in anxiety, irritability, and difficulty relaxing. In addition, shortness of breath can occur, especially during light or moderate exertion. As the heart is working harder than it should, the body feels it needs more oxygen to keep up the pace, causing excessive tiredness and wheezing. Other associated symptoms include muscle weakness, feeling shaky, and excessive sweating. These signs are often accompanied by unexplained weight loss, insomnia, and mood swings, all resulting from the accelerated metabolism caused by hyperthyroidism. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. Diagnosing arrhythmia and tachycardia in patients with hyperthyroidism is a crucial step in understanding cardiovascular health and managing symptoms. The first step is to carry out thyroid function tests, which measure the levels of thyroid hormones in the blood, such as TSH, T3, and T4. Normally, in cases of hyperthyroidism, TSH is low and T3 and T4 levels are high. Next, an electrocardiogram is essential to assess the heart rhythm and identify abnormalities such as tachycardia or arrhythmias, which are often associated with hyperthyroidism. An echocardiogram, on the other hand, uses ultrasound to visualize the heart and its function, helping to determine if there is any impact on the organ's pumping capacity. To monitor intermittent episodes, a 24-hour Holter can be used, recording cardiac activity for an entire day. Additionally, tests to identify the cause of hyperthyroidism, such as antibody tests or thyroid scintigraphy, can be carried out to better understand the condition. With an accurate diagnosis, it is possible not only to treat the cardiac symptoms, but also to address the thyroid dysfunction, thus improving the patient's quality of life and preventing more serious complications. Treatment for arrhythmia and tachycardia in people with hyperthyroidism usually involves two approaches: controlling the excessive production of thyroid hormones and, at the same time, directly treating the heart problems caused by this imbalance. Once hyperthyroidism is stabilized, heart symptoms usually improve considerably. Here are the main treatment options. 1. Antithyroid drugs. These drugs, such as methimazole or propylthiouracil, are used to reduce the gland's production of thyroid hormones. They help to balance hormone levels and, over time, relieve symptoms such as tachycardia and arrhythmia. However, treatment can take weeks or months to take full effect. 2. Beta blockers. For immediate control of cardiac symptoms, doctors often prescribe beta blockers, such as propranolol or atenolol. These drugs don't treat the cause of hyperthyroidism, but they do help to reduce the heart rate, control blood pressure, and relieve symptoms such as tremors and palpitations. They are effective in quickly improving the discomfort caused by tachycardia and arrhythmia. 3. Radioactive iodine. This therapy involves ingesting a dose of radioactive iodine, which is absorbed by the thyroid, destroying part of its cells. This reduces the activity of the gland and consequently decreases the production of hormones. It is an effective treatment, but it can take weeks or months for hormone levels to stabilize, and in some cases it can result in hypothyroidism, which then requires ongoing treatment with hormone replacement. 4th, thyroidectomy surgery. In more severe cases, when other treatments are not effective or are not viable options, surgical removal of the thyroid may be recommended. After surgery, the person will need to take synthetic thyroid hormones for the rest of their life to compensate for the absence of the gland. However, this approach eliminates the cause of hyperthyroidism, resulting in the resolution of cardiac symptoms. 5th, treatment of arrhythmia and atrial fibrillation. If arrhythmia persists, even after the hyperthyroidism has been controlled, specific treatments may be necessary. This may include the use of antiarrhythmic drugs to stabilize the heart rhythm, or, in more serious cases, procedures such as catheter ablation, in which radio waves are used to correct the heart rhythm. 6. Lifestyle changes. Although medical treatment is essential, lifestyle adjustments can also help control symptoms. Avoiding stimulants such as caffeine and nicotine, which can worsen tachycardia, is a common recommendation. In addition, learning stress management techniques, such as meditation or breathing exercises, can be useful in preventing stress from aggravating heart problems. 7. Continuous medical follow-up. It is important that patients with hyperthyroidism and heart problems have regular follow-up with an endocrinologist and a cardiologist. Periodic examinations ensure that hormone levels and heart function are under control and allow adjustments to treatments as necessary. Effective treatment of hyperthyroidism usually relieves heart problems, but it is essential not to neglect the symptoms of arrhythmia and tachycardia while the thyroid problem is being resolved. With the right approach, most people manage to restore normal heart rhythm and significantly improve their quality of life. That's it. If you're experiencing any of these symptoms, it's essential that you see a doctor as soon as possible. Often, these signs may seem mild or even normal, but ignoring them can lead to more serious complications. Hyperthyroidism and its consequences for heart health should not be underestimated. Seeking medical help before problems escalate is a smart and preventative move. The sooner you receive a diagnosis and start treatment, the better your chances of avoiding serious complications, such as heart failure or more serious problems that can affect your quality of life. Don't put it off, because your health is a priority. In addition, regular follow-up with a healthcare professional is crucial. They can monitor your condition, adjust treatment as necessary, and ensure that you are on the right road to recovery. Never hesitate to talk about your concerns with your doctor. Your health is very important and deserves attention. If you're experiencing these symptoms, don't wait. Make an appointment and take care of yourself. Taking care of your thyroid is taking care of your heart. What about you? Have you ever had any of these symptoms thinking it was anxiety and then found out it was a thyroid problem? Tell us your story in the comments and let's share experiences. Did you like the content? Subscribe to our channel for more videos on thyroid health. And if you have any questions, leave them in the comments and I'll be here to answer them. See you next time.